303,000 women die every year, according to statistics. That is the UN, that is the latest UN global estimates. The word to underline there is estimates, meaning that they just, try to round up the figures. Could be higher than that, certainly not lower, because what they actually have are those ones that were reported and they were documented. So they just estimated. So the estimates say that every year we have about 303,000 women who die. It equates to about 830 women dying every day. If you do the math, approximately 303 dying a year, that gives us about 830 women dying every day. Now, for that to be possible within a 24-hour period, it means that every 2 minutes or thereabouts, every 2 minutes, in the time that it's taken me to welcome you to this program, about 2 women somewhere in the world have died. Now, the report also states that in Nigeria, more, that is over 50,000 women die from just childbirth related incidences. Now, in the whole world, till today, Nigeria and India carried the burden of at least about 1/3 of those figures. What is responsible for this? Many things. If we had to be honest, many things. But we're going to be looking at just one of them. And this is why we're going to be talking about puerperal infections. And puerperal infections, I think, well, Dr. Sumaya Kabir will be telling us more. Another word for puerperal infections. What are they? What exactly is puerperal infections? So first, Dr. Sumaya, you're welcome to the studio of Invicta 98.9 FM. Welcome.
Thank you very much for having me.
It's great to have you here. So, Dr. Sumaya, what is puerperal infection? What is it actually?
Well, puerperal infections is actually 2 words joined together. There's the puerperal and the infection. And puerperal is actually the time period between birth of a baby till 6 weeks after delivery. That time period is the time of puerperium. And infection is, well, infection. Mm-hmm. Infection could be bacterial, could be viral. But puerperal infections is mainly bacterial infections gotten during puerperium.
So just so that we are clear, so that the English will understand it very well.
Yes.
There's a puerperium period.
There's a puerperium.
And that period is from what time to what time?
From delivery of a baby till 6 weeks after that time.
Okay.
That is the time of the puerperium.
So would it be right to also say you can call puerperal infections postpartum infections?
Exactly, yes.
Okay.
Yes.
Okay, so after birth infections.
Birth, yes.
Okay. So how much of this particular factor is responsible for maternal mortality? Do you know, do we have a figure of how much of an impact it has on the health of a new mother?
Well, actually it's a lot, because as a cause of maternal mortality, it's a 3rd leading cause.
A 3rd?
Yes, postpartum hemorrhage and puerperal sepsis. Puerperal sepsis can also be gotten from that is puerperal infections. It's actually a sub of it. Mm-hmm. And it's kind of debilitating actually, because of the level of low level of education that we have amongst our women. Low level of education, low level of income, low standard of living. And actually, and also this cultural practices that a lot of these women have. People tend to just ignore it and just take it as part of a normal part that a woman has to like withstand this kind of situations to go through. It's kind of kind of look at it as something like when she undergoes this kind of situation, she's termed as strong or whatever. When actually it's kind of it can be dealt with it, but some of it can be self-limiting, and a person can just like go through it and even it can go unnoticed. But a lot, actually, a lot. Because since it's a third leading cause of maternal mortality.
Does it help if one catches it early?
Yes, exactly. Because there's a way we kind of categorize it. There are like causes from genital tract. This genital tract is just a big term for the birth canal where the baby came out from. During that time, before delivery, there are events that happen before delivery, during delivery, and after delivery. So before delivery, when a woman like ruptures this membrane, this kind of delay term for water breaks. It's kind of when the sac that is containing the baby breaks. This exposes the mother and the baby to developing infections. And when this happens before labor, it's called pre-labor rupture of membranes. When it happens and stays for a long time before a mother goes into actual labor, it can lead to ascending infection from the birth canal to the fetus. Can cause death of a fetus, actually, can be as bad as that, can even also cause the life of the mother also. Then also some events that occur, the repeated vaginal examinations that we do, it's actually done to help the mother to access the progress of labor. But when it's done repeatedly, when it's done is like on aseptic procedure, it can lead to also development of infections, like kind of pushing the infections forward, even though it's not done on purpose. Then also other things are manual removal of the placenta. The placenta comes after the baby, but sometimes the placenta can get retained, sometimes the placenta can get stripped, some of it can get retained inside, and also blood clots can also get stuck in. So the person taking the delivery, conducting the delivery, has to like manually, even though she does it in an aseptic procedure standard, use an elbow glove and kind of scoop out the product. But in doing so, in trying to like help the mother, infections can also set in. Yeah, and then also other causes can be from lacerations. Not really, and laceration is just a big time for tear that a mother has during delivery. And sometimes we also, healthcare personnel, also try and do something called the episiotomy. Episiotomy is just a big term for a cut that is done surgically between the vagina and the anus to kind of increase the caliber of the birth canal to aid in delivery of the baby. Actually, all these things are done to help the mother, help the baby. But in doing so, things can happen. These are these things. Then also, when there are retained products, when that manual removal isn't done accurately, or maybe it has been overseen or something else, these products that have remained, they are not in the actual place. They are not supposed to be there. It can harbor infections, can lead to infections later. Then how a mother can know whether she has this infection from the genital tract.
Before you launch into that, let's go on a commercial break, Dr. Sumaya.
We'll
be back, and then I'll tell you a bit about what I went through when I was having my first child, and then we'll talk some more. You're listening to Dr. Sumaya Kabir with us in the studio right here on Your Health 360. Do stay with us. Let's go catch these commercials, and we'll be right back. Your Health 360, only on Invicta 98.9 FM with Jacqueline Adebijan. All right, thank you for staying with us through that commercial break. Still on the program, Your Health 360, right here on Invicta 98.9 FM. And with me in the studio, Dr. Sumaya Kabir, and we've been talking about puerperal infections. Before we went on that break, I told you that I wanted to tell you a little story because, as you were describing things to me, or to all of us, Dr. Sumaya, I was just imagining myself when I was having my children, especially my first child, that I had in a teaching hospital. Now, I will tell you this, that this was how I had my legs intermittently, where I was in, they have what they call the first, the second, and then the last stage of labor.
Yes.
So that place where they call the first stage of labor, we were many women there. Everybody was calling on their own God, and everybody was doing things, displaying on the bed,
Yeah.
going under the bed. We were not exactly clean, because sometimes you would get up, kneel on the floor, praying, or sometimes just for relief for that pain that you were feeling. I couldn't really say where the pain was coming from. And intermittently, you would see a doctor just walk by. He would come and say, "Madam, oh, it's time to check you." And then I would lie down on the bed and then spread your legs. And then you spread your legs, and the doctor wears his gloves and he says, "Well, this woman is something, some." At that point, really, all the jargon I cannot understand. But just for instance, he says, "Oh, and this woman, you can see she's about 2 centimeters dilated already." And then he'll remove his hand and say, "Okay." One of the students would wear a glove, and then he would be guiding their hands and saying, "Okay, you can you see what 2 centimeters looks like?" And the person will say, "Yes, yes, yes." That one will remove his hand, and then another will come and put in her hand, and he will say, "If you touch this place, you can feel the fetus head," and all of that. Now, I'm making light of it, but I'm telling you, Dr. Sumaya, after I had my child, the first child, I can tell you that I had so many infections, and it was just God that delivered me. So the question truth be told, I wouldn't even have it any other way to go to a private hospital, because there were too many experiences where there were doctors who were not experienced enough, and people lost their babies, some of them even their lives, because they didn't have the wealth of experience that you would get in a teaching hospital. I do understand that you need to teach students, and then we have this contradiction where the more you are, introducing your hand, you might be pushing up infections. And as a matter of fact, the bag with the amniotic fluid had actually broken for me. I had a very long labor, and it had actually broken. And here we were having, I cannot even count at this point how many people, used my hoo-ha to learn to learn medicine. So yeah, I have also contributed to the advancement of medicine in Nigeria.
Yes, there's a downside of everything. That's what the sound, especially when you're in a teaching hospital. There are a lot of doctors, a lot of students. Everyone wants, like, even let me not say you're not actually and it's something to learn on, but actually whenever a patient comes, everyone tries to learn on that patient. Everyone, even the doctor, the most senior, everyone. So actually that vaginal examination is actually done to help. During normal labor, every hour a woman is supposed to dilate by 1 centimeter. That cervix is supposed to dilate by 1 cm every hour.
Right.
So like where I am practicing now in Barodico Teaching Hospital, how we do it is 4 hourly, to just decrease this level of vaginal examination. So it's expected by 4 hours. Like when she comes on hour 0, let's say she's 2 cm. So by 4 hours she should be like 6 cm dilated by then. So then when she's not dilated by around that time, maybe it's still like 3 or 2 or so, and maybe it's getting over and getting to like 12 hours or more, then maybe there's a problem. There's also a pathograph that we use, that we call a pathograph. It's kind of like a graph to just use it as objectively to assess the progress of labor. And there's a line that it can reach. When it reaches the action line, it means action must be taken at that time, either to rupture membranes when they are not, because rupture membranes can also help to progress labor, or to augment, meaning giving an IV oxytocin to like kind of help her when she's having inadequate
to speed up,
to speed up things, or when she has contracted labor, her contracted pelvis. It happens mostly in maybe younger women or short statured women. The CS actually is the solution for that. So you see, when it's not done, contracted pelvis that can lead to obstructed labor is also another leading cause of maternal mortality, especially when it happens when women deliver at home, on booked patients and all. So you see, the downside is this infection that happens. But that is why when a woman is about to go home, we place her on prophylactic antibiotics. We just say prophylactic, just in case, because we anticipate like this state that we did can lead to infection. Then also she comes back after 2 weeks for postnatal care to really assess and make sure that she's not having these symptoms of infections, or like she's okay and everything.
Okay, so this is
Yes.
where I would now ask that what should women who have just had babies look out for in their bodies before, even those 2 weeks? Because you might find that you need to go back to the doctor before 2 weeks. Now, many times, okay, like for me,
Yes.
I started experiencing, I would just be sitting down and then a ripple of cold will just run down my body and I would be like shaking like someone who, like suddenly.
Yes.
And then I'm okay, and then that cold just comes again. Now when I explained this to the adults, because I had my mom, I had my mother-in-law with me, I was told, oh, it's your body trying to adjust
Recover.
itself.
Yes.
But it was God that saved me, because I actually had an infection.
Of course.
So
Of course.
what are some of those signs that a woman should look out for? And just say, take me to the doctor. Don't wait for our, old wives and, tales about
Giving advice.
giving advice.
Yes.
Just get yourself to the doctor.
As the first sign, and the most common sign is fever, high temperature, getting really cold, shivering, then sweating later on. Some can really thirsty. It's maybe malaria. Just give her like paracetamol or anti-malaria. She might get better. But that fever, when it stays for more than a day or two, it should just raise and signal like something is going on. And then another thing is constant abdominal pain, even though it can be mistaken for postpartum pains. That condition that happens like
Where
when
the womb is
contracting.
contracting.
It can be mistaken for that. But aside from that, another thing to add with is when that lochia, that vaginal discharge a woman is having, is foul smelling. That smell is like offensive. So when you add that plus the abdominal pain plus the fever, just go to the doctor. Just see the hospital. Some can just start, okay, let's do this, let's do that. Or just some can just say, okay, I took this medicine when I was ill, when I had similar condition, I took this also antibiotic. They just give you that own like side doctors. You have
I'm
a
telling
lot
you,
of
Dr.
times.
Sumaya, I cannot begin to tell you how many hot water baths I had. Every time I would have that cold thing run down my body, I'm like, grrr, like that.
Yes.
I would hear, oh yeah, it's time to go and have a very hot and uncomfortable bath where they are taking very hot towel and banging you to the wall, like stand up, and then, pushing your stomach. Of course, at that time, blood comes out and, you feel some relief. But honestly, I'm just thinking what would have happened if we didn't have that push to go and see the doctor.
Yes.
Many women, I beg your pardon, get bogged down by a lot of people saying, oh, that's how childbirth is.
Exactly,
and all of that.
exactly. We are just as strong women. Be strong. Don't need to see the doctor for just this minor thing. I've had this. So person had this kind of situation.
Right.
And they're doing well. She now has 5 children. So children. Like we're all the same, and we're just all supposed to not see the doctor unless we're about to die.
Right.
That's when they come rushing with the patients, unconscious, convulsing, a lot of things, smelling all over. When you see, then they will die on the spot, and then they will say doctor didn't do anything, or like our patients are dying in so hospital. Just time it as just a death zone for a person. When they're supposed to come, when they're just having those mild symptoms, they're supposed to just be doing things, and they even add to their situation by having herbal concoction, giving all sort of barrage of things to just help them.
Yes.
So when a woman gets to the hospital, there are investigations that we do, and we do like have a vaginal swab to like culture this offending organism and know the appropriate antibiotic to give. But initially we give like a broad spectrum antibiotic to just like taper that form of infection. Then also full blood count differentials to just knowing, it's just like tells us like yes, an infection is ongoing in the blood, in the blood culture. Just are just like big terms for this infection. As a form of general management for these genital tract infections that occurs, these women, I don't know, maybe we are not trying on our part, but there is a preconception care actually that is done before a woman takes in there's a care, like when you're ready, I'm ready, like, let me say I'm ready to I'm ready to have a child, you can visit the doctor, take baseline investigations like screen for hepatitis B, hepatitis C, retroviral disease, as HIV, screen for syphilis. Also, then also your blood level is checked to make sure it's normal. Then also there's a prophylaxis folic acid that is given. It's a drug that just prevents neural tube defect. Neural tube defect is just a big term for birth defects the baby has, and mostly these birth defects happen during the first 12 weeks of pregnancy, and these first 12 weeks this is a period of time that a woman doesn't really know she's pregnant, and this is the time that a lot of things happen. And this is the time of this development, the cord, when the brain and the spinal cord of the baby develops. When there's a problem around that time, neural tube defects this just it's a big topic on its own, but this folic acid actually helps. It helps to prevent it. So when this is a preconceptional stage. Then for the antepartum, this is the antenatal care. It's really now it's wide known, even though there are a lot of women that really don't go to, especially the ones that have more multi-parous women, let me say. They just feel like they're like, I'm a graduate.
They become professionals.
They just professionals on their own. So when you go, a lot of women also don't really visit the hospital until they're pregnant. So we doctors try to take advantage of that time and screen, help in do everything. When she comes, her blood pressure is taken, urinalysis is just a urine test. These two, when you put them, to assess for high blood pressure, diabetes, syphilis, hepatitis B, hepatitis C, HIV, and also to check her weight and height, and her body mass index, to know either if she can really give birth on her own, or to prevent obstructed labor, or if she can just go for cesarean section. And also, if someone has a previous cesarean section, we do this trial of vaginal births. So we kind of try the mother, do short trial to just allow her to go in labor for a short time to see if she can really give birth by herself or just a section. When a woman comes immediately when she gets pregnant, some even don't come till they are 6 months, 7 months, or some come in labor on book. They have never been to antenatal, and the first pregnancy in her life. She hasn't even had a miscarriage at all. Teenager, 18, 19 year old, you just come in labor, and that is where all the saying kata kata will start happening.
Yes.
She come, maybe she has been in labor for over 3 days. Maybe maybe she has having a sign of obstructed labor. Miraculously, sometimes they'll give birth by themselves, but they'll have sequelae in the long run, like this VVF, this
vesicovaginal
fistula.
Right.
Yes, it's one of the leading cause of that. That's obstructed labor. Some will come, maybe they know or they don't know that they are HIV positive. They just come in labor too, give birth. Though when we don't know, the healthcare providers, we won't take all those measures to prevent the baby from getting it. Then later on, the baby will also come. You see infants, a lot of them being infected, and it's the fault of those parents, those mothers. And it's actually sad, really sad. These are the things we can't prevent, we can't help, but we just come. Maybe sometimes actually they see it's kind of, because it's like a taboo, so they kind of shy away from coming. Maybe we will talk about it also. Then also they have other things too that happen during puerperium. These the breast conditions, even though they're kind of self-limiting to some extent, but they can really be depressing. The first thing is the breast engorgement. Breast engorgement is kind of the engorgement that happens. The breast will be tender, swollen, even with fever sometimes. And it happens because the production of breast milk is in excess of what is removed. It's most in first-time mothers, sometimes they don't know how to properly place the baby to breast milk, attach for an attachment. Also, all of that. So what we advise women to do is to encourage breastfeeding. Encourage put baby to breast to suck.
Even when it's painful.
Even when it's painful, yes. It helps to reduce the pressure. And fitting breasts, not this sagging or whatever.
Right.
Yes. Then also you can give analgesia for the pains. There are also warm compress used on a warm towel and placed on the breast to help in relieving those pains. And also you can even manually remove the breast to like relieve those engorgements. Another thing is the cracked nipples. Cracked nipples is just a sore that it forms around the nipples, and it's mainly due to poor attachment and poor position of the baby. Some will just like stoop forward, following the baby instead of making the baby to
come to the breast.
Come to the breast. This so the baby when is suckling on the nipple, than on the darker part, which is the areola.
Right.
Yes, sucking on that, it's kind of like forming a negative pressure and pulling it. So the skin around it, around time, just
gets turned down.
Yes, cracks, and it can even bleed. So when these things happen, what we usually advise is to use there's a lanolin cream that we prescribe for patients to like apply on the area. Some even say we can use the breast milk, actually apply on the sore and leave it to be exposed to air for some time. And we encourage breastfeeding, because this some just say, okay, since there are pains when they are doing this, they won't breastfeed. It can lead to engorgement, you see, another thing, two compounding issues.
Right.
Yes. So, and then another thing is mastitis. Just infection and inflammation of the breast. There are two forms. There's the one that happens around, breast has like maybe two major parts. There's a connective tissue, or we say maybe the surrounding part, and there's a part that actually, like, there are like pipes that actually collects the breast milk, stores it, and like provides when needed. When needed, yeah. So there is a part that when the infection is happening around the connective tissue, that is when we term it the non-epidemic cellulitis, just an example. Then there's also the other part is epidemic adenitis. Adenitis is just when it happens in the pipes.
In those pipes.
Yes. How you differentiate between the two is in one, even though all of them, there's a tenderness, there's pain, there's engorgements, every discomfort, fever also. But for the cellulitis, when you press on the nipple, there won't be pus. There won't be pus coming out. And in that part, we encourage the mother to keep breastfeeding to prevent engorgement. But in the adenitis, when you press on the nipple, pus will be coming along with the breast milk. In that situation, we discourage breastfeeding until we manage that with antibiotics and all of that. And the other things that happen from that mastitis also is abscess, like not on the nipple. Abscess can form just a big pus, form on the area. In that case, we have to like cut and remove the pus manually, so we have to relieve that pain. These are just the like breast conditions that happen. Another like common thing also that happens during the puerperal is urinary tract infections. A lot of things are happening in that area. A lot blood is coming. Some women won't really change their pads more often, and that blood that is settling on that pad really harbors infection. And blood is a nice culture media for infection to grow like nicely. So then and the pad like covers also the urethra.
Right.
Yeah. So infection there settles there, has a passageway to enter the urethra, and women have this short urethra, so infection can really easily
just go right up.
Right up, yeah. So, and how a woman knows that she has this urinary tract infection is when she has pains while urinating, frequently going to urinate, having blood sometimes coming with the urine, having lower abdominal pains and fever also. Then management, what we advise is to change pads regularly, take fluid regularly, regular fluid intake. Then antibiotics in the hospital, not prescribed by your neighbor, by your chemist, by a lot.
Right.
Yes.
We have so many household doctors,
yes,
where
yes.
Everybody's prescribing something.
Everyone.
Because when I had it, this is what they gave me.
With a good heart, actually, but it's not right.
It's not right.
It's
yes.
not right. Yeah.
So, what about headache and dizziness, waist pain? Are those any signs of puerperal infections?
Yes, they could be. During labor, a woman goes through this tremendous pains. Some women, like I would say, it would be dramatic, fall and this, fall and that, shouting, a lot of things just to
get them through that period.
That pain. So yes, and also these headaches can also occur from cesarean section after a woman has an epidural done. That's injection that is given to numb pains from the waist down, or sometimes can be general anesthesia. In that case, she won't really have pains. But when she has that epidural done, she has this headaches that can occur. It's due to that water that was taken a bit, that came out a bit. A lot of these big times for that, it
Right.
just leads to headache, yes. But that headache can sometimes some limiting, even though sometimes it can really be debilitating, can just like cause a lot of issues, which can lead to postpartum depression, postpartum blues, postpartum psychosis. And these are also things, even though it's not really a bacterial infection, but there are things that happen during the puerperium that is actually overlooked, because in this part of the world we don't really see mental issues as issues. They are tabooed on, so we don't talk about it. Even though when we see signs, we kind of shy away and trying to cover up, and it can happen. So this postpartum blues, depression, these are just medical conditions that happen during after delivery. And how a woman knows like she's having these kind of things is when she's feeling sad, tired all the time. Things that usually make her happy before she gets pregnant or even before delivery are no longer interesting. Getting weight, gaining weight rapidly, or losing weight, uninterested in taking care of herself, crying all of a sudden, having mood swings. In 1 minute she's happy, 1 minute she's sad, all these kind of things. Then also feeling like having suicidal thoughts. A lot of women have it too, even though some might even not say it, or feeling the urge to like hurt your baby. It can lead to that too, or like being just nonchalant about every situation, like having no fun at all. All these things, when you can, it can, sometimes it happens really, especially in first time mothers, when it lasts for like maybe just 2 weeks, a maximum of 2 weeks. It can be overlooked. Well, sure, well though you can overlook it or just manage. It's sample postpartum blues in that stage, but it extends more than 2 weeks. It's actually postpartum depression. Postpartum depression when these things like stay for a longer period of time, and how we really manage it. What it really causes it in the first place is a lot of things. With medically or scientifically, it's not really clearly understood, but there are a lot of things. It could be from the just rapid dramatic changes that occur immediately after delivery. There are hormones, this estrogen and progesterone during the pregnancy. But immediately when a woman gives birth, these levels drop. When these levels drop, it really puts a woman at risk of having postpartum depression, all these postpartum conditions. Another thing is genetics. When your mother has it, when mother had this situation, it puts a person at risk of also of getting this condition. Also, things surrounding this pregnancy, maybe death of a loved one, divorces, violence, intimate partner violence that happens also, or maybe the woman was raped. Things surrounding it can lead to postpartum depression. So that's why when a woman comes to the hospital, sometimes when we're asking of pregnancy, when we're doing this pregnancy history, we ask the woman like, did you plan for this pregnancy? Some would like kind of look at it as a funny question. Why should you ask me this? Of course, like, but it's actually because when you ask this, we anticipate what's going to happen later. Yes, these are all of the things. Then other things,
Dr. Zumaya, before
yes.
you continue, something quite ironic that you touched on was it could also be down to genetics, could
Yes.
be hereditary.
Yes.
Yet it is a taboo subject. I mean, how many mothers will say, when I had you, I felt sad. I didn't really want to have you.
Yes.
Every mother
Yes.
has a story of, when I held you in my arms, I just felt immediate
Yes.
love. So nobody really talks about that.
No, but a
And
lot
when it
don't.
happens, you don't even know that this happened to the person, my
Yes,
mother,
yes,
before me.
Yes. Until we start speaking out a lot of times about this kind of situation, people won't come out and talk about it. Everyone will just hide and just keep quiet about it. You see it as a taboo, like it's kind of like, okay, it's not really like stripping naked on the streets. It's something that happens, and we don't really tag it as a person's fault, even though the family members surround people will just say, okay, this one is a mad person in quotes.
Right.
That's just what it's
There's
like,
stigma around
yes,
it.
Stigma, a lot of it. That's why people just keep quiet, and it can go further and cause further harm cause postpartum psychosis. This is the real-time mania. Yes, it can even lead to that, just because of this stigma, just because of that, just because we don't want so person to say we have this kind of thing.
I need to open up the phone line so that people can talk to you, but I know of a lady who says her mother never liked her. I don't know if postpartum depression could be responsible or if there's something else. The mother, she has no love for this girl. The mother had a girl and a boy, just two children. And this particular person I'm talking about, the mother lives in the United Kingdom. She's in Nigeria. Her brother lives also in Nigeria, but in another state. And somehow this, would I call it dislike or just uncaring attitude for this girl does not extend to her brother. The mother relates to her brother like a mother. So can postpartum depression cause that, or is that something else at work?
Exactly. It can be
because she's the first child.
Yes. It could be the first thing, the baseline cause of it. Then this is the progression. Instead of the mania, it's kind of becoming inherent in the mother to just continue being that way. That is why in the form of management of that thing is as this cognitive behavioral therapy. It's kind of a therapy that is done to change the mindset, not really change, persuade the woman to see things on a lighter mood, on a more positive aspect than this. Maybe she didn't get that. Maybe she's still having these guilt feelings. Maybe all these things that we mentioned earlier surrounding the pregnancy happened to that woman. We're not sure, but it could also be that before she got pregnant she was depressed, or maybe she has been having these symptoms. Another thing is the schizophrenia can also be a risk factor for that also. These two things might be, even though you can't really say what exactly it is. It can also be that. Yeah,
okay.
Exactly.
Well, you've been listening to Dr. Sumaya Kabir. She's been the one talking to us about puerperal infections or postpartum infections or infections that happen after the birth of a child up until the child is 6 months.
Yes.
I'm a good student. All right, time for us to open up the phone lines, and the numbers are 081 40,000 989. That number once again is 081 40,000 989. Then we also have 070 87 800 989. Once again, that's 070 87 800 989. Let's take a few calls before we have to go for a commercial break. Hello, good evening. Hello?
Hello, good evening.
Good evening, you're welcome. Your name?
My name is Aiba, calling from Narai.
Abel, you're welcome. Go ahead with your question.
Okay, then I want to thank the guest speaker for a well-explained speech.
For the doctor. Okay, the doctor. Right.
Yes, the doctor. Yes, sorry. My question I want to ask is, though I'm not a woman, but I just like to ask, I've been thinking about it.
Well, if you're not married, you're getting married one day, so.
Yeah.
Go ahead, please.
Okay, the issue of warm bath that is usually done in villages, especially mine, they refuse to agree to the fact that there is a medical medicine for it. Is there any effect, or is there anything that one can do to avoid this warm bath?
Okay, you're saying whether it's useful or not, right?
Yes.
The warm bath. Okay.
Yes.
Okay.
Is it hot bath, not warm, hot.
It's hot, actually. Scalding hot.
Yes.
Like, that's why a lot of women, African women, after a while, have their tummies looking so wrinkled, the skin, because there's a lot of hot water that has gone to work on that tummy. Well, thank you so much, Abel. Let's take another call. Hello, good evening. Good evening.
Hello?
Yes.
Hello?
Yes, I can hear you. Go ahead. Sorry, can't hear you. Hello, good evening.
Hello, good evening.
Yes, you're welcome.
I'm Mommy Joe from Ronin.
Mommy Joe, you're welcome. Go ahead, please.
Your guest has really spoken very well and we've been enlightened. But since I want to ask a question.
Go ahead.
What can there be a problem that will make a child after delivery? The child will be, let's say, 3 points. something. And then gradually the child starts dropping in weight. How can we explain that thing?
Okay.
Up to coming, let's say the child was 3.7 and the child dropped to 2.6, then later to 3.5 at 2 months.
So the child is dropping weight?
Yes.
Okay.
What can the doctor say about it?
Okay. All right. Thank you, Mommy Joe. Hello. Good evening. Let's take this call.
Hello. Good
evening. You're welcome.
This is Joy calling from Kajiri.
Miss Joy, you're welcome. Go ahead, please.
Thank you. Please, there is this observation I don't know, so I want to clarify it. And concerning this folic acid.
Mm-hmm.
Because I noticed since I started taking the folic acid, my stomach started increasing and I'm not pregnant. I don't know why.
Okay.
Then the second question is concerning this hot water bathing that I learned that when a woman gives birth, you have to bathe with one kind of hot water. At the end of the day, you start having marks on your tummy. So is it really necessary or is it compulsory? You must bathe, they must press your stomach. I don't know, please. I really need more light on that area.
Okay.
Thank you.
All right, you're welcome. Dr. Somaya.
Yes.
You remember the questions?
Yes.
Abel was asking about the hot water bath, which our last caller was also asking. Is it absolutely necessary? Then we have the Mommy Joe, who was asking about, the drop in baby's weight. Should they be concerned?
Okay. Yes. The first question about these hot water baths. The answer is actually no. No. What is advisable is this sitz baths, especially when a woman has last tears during deliveries or had this surgically done. So this is the episiotomy.
Mm-hmm.
That is just sit bath, kind of like a top. There are these customized ones that we do. The kind of baby, the woman like not really so hot, just hot, hot enough. Can add salt to it, also then sit on it. It helps to soothing and also helps in facilitating the
healing process.
But this hot water bath is actually harmful. It can lead to hypertension, especially when a woman has hypertension during pregnancy. It can really worsen the situation. And also there are some studies that have been done that shows that combination of this hot water bath that we do and this kunun kanwa that women take can cause cardiac failure also. It can be as terrible as that. Even though it has been advised against it, up to now people still do it, and we still see patients coming with this kind of situations. Yeah. Then the question about baby's weight dropping. After a baby is born, initially in the first, let's say 2 to 3 days, baby's weight drops by maybe a 1.1 or 0.2. But with this, when baby's weight is dramatically dropping, a mother needs to check the baby if a baby is having fever, or maybe baby mother isn't really feeding the baby properly, feeding baby well, or sometimes this can happen in babies that have been prematurely born, that don't have this ability to suckle properly is maybe low on them. So they won't really be latching on the nipple properly. This can lead to this poor suckling, poor feeding. The mother can just think maybe baby is the baby's mouth is on the nipple, but really it's not really suckling it. This can also lead to baby's weight dropping. And maybe when the baby has there's this thing called neonatal sepsis. Apart from the puerperal sepsis, there's also neonatal sepsis.
Okay.
There's infections for the babies. Fever is a sign. Frequent excessive cry, abdominal distension, anything out of the ordinary can be a cause. Then when you notice baby's weight dropping like this, you really need to go to the hospital and check.
In short, that's just it. Get yourself to the hospital. So, Mommy Joe, I hope you get that baby to the hospital ASAP. That's very, very important. Let's take another call. Hello, good evening. Hello.
Good evening.
You're welcome. Go ahead, please.
Okay, please, I wanted to ask what's the difference between puerperal sepsis and puerperal infection?
Okay, puerperal sepsis and puerperal infection. All right. Is that all?
Yes, that's my question for the doctor.
Okay. All right. Thank you for calling in. Dr. Sumaya, the difference between sepsis and infection, puerperal sepsis and puerperal infection.
All right. Well, puerperal infections is infections gotten during the puerperum, and it's not really isolated to the ones gotten from the genital tract. It could be, as we already said, from the genital tract, like from the urinary tract. Could be breast infections. Could be gastrointestinal. Could be respiratory. Could be thromboembolic. These are the ones that could be happening with the veins. While puerperal sepsis is the one gotten solely from the genital tract that will lead to septicemia, infections that becomes overwhelming to the body. But the source of it is the genital tract. These are the main difference between that.
Let's take another call. Hello, good evening.
Hello, good evening.
Yes, you're welcome. Go ahead, please.
Good evening, Madam Jacqueline.
I can hear you, Ma. Go ahead.
Yes, this is Mama Mustafa from Agua Tennessee.
Mama Mustafa, how are you doing?
Fine, thank you, Ma.
All right, go ahead. You're welcome.
Yeah, well done, Ma.
Yawa.
Is this my neighbor that asked me to ask doctor this?
All right, go ahead.
Before she gave birth to her son, she had an miscarriage, about 3.
She had what?
So, she had miscarriage, 3 miscarriages.
Okay, 3 miscarriages. All right.
Yes,
go ahead.
before she gave birth to her first son.
Mm-hmm.
So after that, she has started having this stomach pain. And she just go to the hospital. After that, she had another child. In short, she had 4 children after that miscarriage. And she still complaining about stomach pain. So she just want me to ask the doctor what can cause the pain for her. And I want to commend our doctor. May God be with you. And Madam Jacqueline too. May God be with you and your family.
Thank you, amen. Thank you so much, Mama Mustafa. Can I ask, and Mama Mustafa is gone, I wanted to ask, the stomach ache, is it something that happens immediately after the childbirth and then it stops, or this how she just continued to have stomach pain and she had 4 kids?
Oh,
I don't know.
Well, maybe she had puerperal infections maybe after the first child that she had, before this one that she had. And one of the complications of that is chronic pelvic pain, actually.
Okay.
Chronic pelvic pains. Maybe that is what is happening to her.
How does that pain feel? Under the tummy?
Yes,
the back?
pubic pains with kind of back pains, lower back pains, just there. Kind of, it's the kind of that pain that is there. It's not something for you to shout about, but it's always
just
there.
there.
It's just there. It's something that maybe kind of you take it, something you live with, kind of.
And honestly, it can cause depression to have chronic pain like that.
Chronic pelvic pain is one of the complications of that, actually. So maybe that's what she's happening. But she is advised to see the doctor for proper evaluation.
Okay.
Yeah.
So, Mama Mustafa, hopefully you get that lady to go see the doctor, even though she's had 4 children. Dr. Sumaya, I told you that the time was going to fly by.
Exactly.
I mean, look at the time, and we still have questions for you. But thank you so much for coming in this evening. We really do appreciate you. Last line for mothers out there, new mothers, you want to say something quickly? As someone who sees them every day coming to Barrow Diko.
Yes, mothers, new mothers, congratulations to you all. So, like we've already said, we've talked about all the telltale signs of this kind of infections. Take care of yourself. Please change your pads regularly, 1 hour every 1 hour. Do your sit pad, but don't do those hot water baths. Those kununkanwa or whatever, please abscond from it. Don't take all this advice from neighbors, this and that. Please consult your doctor. Doctors are available all the time, even though we are overstressed. But yes, we are available. We are here for you.
She just had to add that.
Yes.
Thank you so much, Dr. Sumaya. We really do appreciate you. With 303,000 women dying globally every year, puerperal infections, sepsis, whatever has to do with childbirth should not be taken lightly. And that's why we appreciate people like Abel, who is not yet married but is interested enough to know, because hopefully tomorrow, if the wife begins to show any sign whatsoever, he's going to be there for her. Women, at that point in our lives, we really do need all the support that we can get from our men, from our families, all of them. Hands need to be on deck. Here is praying that Nigeria will very soon be excluded from that list whenever they're talking, and find ourselves in more pleasant climes. Once again, Dr. Sumaya, thank you.
You're very welcome.
Until next week, Your Health 360 will return on Friday at 7 p.m. Have a great weekend ahead.